Let's resume. Bay Area Legal Aid is a non-profit law firm that provides free legal services to the community, and especially when it comes to healthcare access matters, we do not have an income limit. So anyone with any income level can get help from us if you are having an issue with either the health plan, with the county not being able to sign up for Medi-Cal, or if you're having issues with Medicare, trying to enroll. So any sort of enrollment issues, termination, denial of services, those are the things that we can provide support on. And today I'm here to share a little bit more about the rule, public charge rule. And this is something that has been in the books for 140 years, so it's not something new, but since the previous administration brought this up, and I know that there were a lot of fear in terms of what's public charge and how it's being determined or looked at, and that's where a lot of folks are having this chilling effect, and they are not applying for the benefits that they would otherwise qualify. Just to let you know, and I'm not here to give you a lecture on public charge, but just a quick to know is make sure when you talk to the client, let them know that not everybody is subjected to public charge. Public charge is usually for those who are trying to apply for an immigration visa to enter the U.S., or who is trying to apply for adjustment of status to get the green card. That's at the stage where the government looks at whether or not you may become a public charge. And that there is a huge equation in terms of how to determine public charge. And so just because that you're being looked at to see whether or not you're a public charge does not mean that you may end up being, or whether or not the government will determine that you're a public charge. So for public charge determination, if you are a LPR, permanent resident, you are not subjected to public charge. If you are here under asylum status, or victims of domestic violence, T visa, those are all the categories that are exempt from public charge determination. So there's so many different categories in there that if you need to sit down and talk to the client and then find out if they may be subjected to the public charge rule, please talk to us if you're not sure whether or not they may end up being part of that determination. So that's why you can contact our phone number, which I just provided, is on the postcard, and we have attorneys who speak different languages, English, Spanish, Vietnamese, Chinese, Korean, so they can get help in different languages. And if you have a client who called in and we don't have an attorney on staff, we can use the interpretation line to help them as well. Going back to public charge just a little bit more, public charge does not apply to things like Medi-Cal programs or other public benefits that are not non-cash benefits. The only Medi-Cal program that is subjected to public charge is long-term care. So if you're going into a nursing home for a long time, that may be, you may be subjected to public charge, but the government just recently clarified that for those who are using home and community-based services for a short term will not be subjected to the public charge determination. So make sure that people understand and not be afraid of using the programs that they may otherwise qualify. So generally the rule only applies to folks who are getting cash benefits. And certain cash benefits by the government, usually the federal government. So that's where we need to sit down and talk to the client, make sure that they understand that they may not be subjected to public charge. And those who are permanent resident, of course, they're not going to have to worry about being subjected to public charge. If they're under certain exempt programs, they're not going to be looked at when it comes to applying for adjustment of status or trying to apply for an immigration visa. So any questions on that? Go ahead. Yes, so if it's a so if it's health program that's provided by either the state or county government, that should not be subject to the public charge rule. And I would recommend that if you are talking to a client who's concerned about public charge, have them contact our office. We have an immigration department as well that deals with determining whether or not it's a public charge. But you can call the healthcare line as well, and our healthcare attorney will be able to help you determine whether or not that person may be subject to public charge. And I'll be around to answer any questions folks have. I know that sometimes it may be daunting to ask questions, but I'll be here for a little bit to answer questions.
Thank you. Awesome. So I think down to the next items are part of the reason that we brought you. I'm trying to get all my thoughts together. That we wanted to have this first time kind of get together in terms of VHP is to be able to hear from the people that serve the communities what is the need and how can VHP be part of the solution. So we know there's issues, we know there's things going on, but what can we directly do in order to be part of, finding coverage, part of finding, clinics that we should put in our network and things of that nature. So how can we be a part of that? How can we collectively work together? I've only been with VHP for a little less than a year, but my passion still stays true in terms of finding the coverage, getting to the community, helping people know what is out there, whatever the case may be. In this case, it's health insurance, medical insurance. So it's just always that community aspect. So that's why this was so important for us to do and to get everyone that we put together that made a difference in Region 7, which when we reference that is Santa Clara County, and Region 9 is San Benito, Monterey, and San Benito County and Monterey County. So that's the Region 9 where Alexis and I serve a large, a large ground of area. And so for the next portion of our presentation is just the discussion, how we have some questions, but is there anything off the top of anyone's head? I know there's a few that came in through the questionnaire that we sent out of like what kind of questions, but is there anything that anyone would like to ask or share or just to make sure that we have time to hear you as well before the music gets louder? Yes. Oh, and when you ask, if you can please let us know who you are and where you're from.
Thank you so much, Jessica. Good afternoon, everybody. My name is Karina Dominguez, and I'm one of the city council members in Milpitas. I'm also running for mayor. One of the questions that I have, which is a huge issue in my city, is that the city is a one zip code city. And so many times as providers, you know that the resources go out based on the data that's provided by the zip code. What happened during the pandemic was that as elected leaders, we knew where those vulnerable, challenging neighborhoods were in our city, but it took a really long time to get PPE, COVID-19 vaccination sites because they were all being pushed out based on zip code and the data that was collected per the zip code. And so as I'm moving forward and building a vision for Milpitas, that is one primary area that I need help with. Is I know we can't change policies overnight and bureaucracy takes forever, and so I've also been a provider working in nonprofits for over 20 years, and so I know that the work you guys do is so important, how important partnerships are. So if you have any idea, we do have an ICC, which is the Indian Health Center in Milpitas, and I just feel that sometimes local jurisdictions depend on the county for services, but I actually think that we need to have an active role as a local jurisdiction in disseminating that information and making sure that enrollment happens in these particular pockets where our vulnerable families are. And especially in Milpitas, our diversity is very high. It's Latino, Vietnamese, and Filipino. And so it's really important for us to get those resources. So if you want to come to Milpitas and partner, for sure I'll be there for 6 months. So this is fast that I need to make sure that the foundation is there. Almighty, hopefully this universe allows me to be there longer, but I really do need to get that foundation in, because what I would hate is another pandemic to hit Milpitas and that we move in the same process that unfortunately we're stuck in that couple years. So if you have a solution, yeah.
By one zip code city, are you saying that because you're one big zip code city, you don't have a lot of medical offices and doctors because it's based on having multiple zip codes?
Let me clarify. So, great question. I appreciate the question. So, the city of Milpitas is a 95035 zip code, and whereas like the city of San Jose has 95116, is the east side, 95127, and so forth. So, when COVID-19 hit, everyone was looking at the positive rate of COVID per zip code, and they deployed the emergency resources to that per zip code. But in Milpitas, our average income is $110,000 if you look at the entire zip code. So that would never qualify for us to be on the priority of resources that are being deployed into Milpitas. And even if when any provider is looking at making that map of where they should go, they look at the zip codes. So what happens is that the areas in my city that need help that would fall into the demographics of like a 95116 area, they get left behind. And we're not prioritizing them. And so then what happens is it turns into a very NIMBY city. Because the diversity is there, but the diversity of income and the diversity of resources is not. And then you form discrepancies in health access in our apartment complexes or those areas that do mirror areas like the 95116 area. Does that answer? Thank you so much. I appreciate the question.
That's actually really good information because when we do our research on our end, we look at zip codes. So it's actually a really good insight. Yes.
And I feel that I don't think the zip code should be a priority because it's the service that you want to the community, and it doesn't matter what is, because it was, like she says regarding the COVID, why do Los Gatos get it exactly, and it was certain staff that got it, nurses were and we're still struggling.
And you're talking about the vaccine?
Yes.
Everything. They got everything right away.
So my thing is, services, appointments is one of the biggest complaints of our community. I can't get an appointment. Right now, school has started, and if I do that, what do I do? I can't get an appointment because my next appointment is until the end of October. I need to get into school if I don't get this vaccine. And if you send them to Walgreens, does anybody know here what's the cost of varicella at Walgreens?
100 and something?
No, it's $200.
Wow.
I have 3 kids. What am I going to pay? $600 or put food on the table?
And can you tell us your name and
I'm
org?
Esther from Public Health Immunization.
Hi Esther, thank you.
The only reason why is because I've been here for a long, long time, and I see how everything has moved away. Yes, we want all these families to have homes, but there's no more walk-in services. There's no accessibility for our
Okay. Thank you. That is really, yeah. Next up.
So, hello everyone, my name is Rosa Cepeda and I'm the Public Information Officer at Gatlin College. For those of you who don't know, we're opening a brand new campus in Hollister because of the growth there. So I want to piggyback off a couple of things that Esther said. So I can tell you, our community, if there's no walk-in services, first of all, I would say the biggest thing that you have to do is in the outreach, because technically our community just works and works and works 2 to 3 jobs and they don't take care of themselves. And I have to say that even for me as a professional, you know, during the pandemic working 80 hours, I wasn't doing that. But given to what Esther said, if it's too cumbersome, they'll just wait and they'll go to Mexico and they'll go to Tijuana and they'll pay cash and it'll be much cheaper and they feel more confident because they really feel that it's too bureaucratic. Healthcare here for our people, it's like my dad would say, you know, it's short que me están pidiendo sangre, right? Like it's short of asking you for a vial of blood. And so with Esther, when my family came here in 1975, we had the Virginia clinics, right? You just walked in, you got services. Why? There's another reason why you need to walk in. Our communities work 2 to 3 jobs to just live in Santa Clara County, which many of them are being pushed to San Benito County, which includes your area. And even that is becoming expensive. So they don't even have time to wait until then, right? Or then from there they'll go to alternative types of services. So I think, and this is one thing that when I was at San Francisco City College, when we were doing our own outreach there, that folks, even in education, didn't understand, is that our communities, you need a different type of outreach. First of all, you need people who speak their language. You need people who look like them. You need cultural sensitivity. Please don't make the mistake that the NFL just did with messaging. And aside from that, you need to be able to reach them. Younger populations are great on their phones. Older populations are not. The older populations need to be able to do the old phone call way type of thing. So I've seen so many mishaps in terms of reaching our community. I could tell you that you guys know the numbers. I don't have to tell you the growth and all that. But when it comes to healthcare, I think the best way to approach it is really educationally, accessibility, and accessibility means real accessibility. Don't tell them it's easy and then they show up and they become frustrated and then they're asked to come again, because then they won't go back. So that's all that I want to share. Thank you.
I have a question.
Thank you.
Have you seen a model that works really well?
Well, you know, I have to tell you, Kaiser has been doing a decent job.
What are they doing?
So one of the things that they do is, I could tell you my parents, my dad is 72, and you know, my mom is gonna be, you know, no, my dad's gonna be 75, my mom's gonna be 68 this year. And one of the changes I've seen as a result of many years ago when I was consulting with them, and they came out with this horrible campaign called Novelas, I go, we watch novelas. Novelas is not gonna make us go to the doctor, okay? And they had spent millions it was so botched, right? And I told them your campaign sucks. And so they had brought me in and I consulted with them. But one of the things that they've done really well is that they've really done with my parents, my parents are like half illiterate. And even though they have the smartphones, they get the phone calls. My dad, and then my mom goes, oh, no te puedo hablar, es el hospital, right? Like she knows now the number, and she's memorized the number, and then she's like, oh, this has to do with my pills, right? But it's accessibility at their level, communication at their level. It's not forcing them to become something, that skill set they just will never ever have. Do you know what I'm saying? Very similar to when ATMs came around, right? And back then I was in the banking and they were trying to just ransack Latino communities. You must use the ATM, you can't come in anymore. And then what happened? All these banks lost all this money, right? So I would say that you really, and the one thing, you all know this, but I have to remind everybody, Latinos, we are a spectrum. Millennial Latinos behave one way, okay? Baby boomer Latinos behave another way, and then there's my 94-year-old grandmother, okay, who cannot read and write, but she gets the best health care because they've done a really good job that her point person, her son, is on it, and that they know how to communicate to him to communicate to her. So within that, I gave you these major, huge groups. And so I think that what never works is one size fits all, and it's discouraging when corporations with medical services just go, hey, we got it, we got the model. It's not one model, it's multiple models. Okay, thank you.
Thank you, Rosie. Well, this has been great. I think that segues. The music might get a little louder, so we might have to get a little louder. But I think this segues into our question of what do you want to see from your healthcare provider, in this case VHP, in order to be able to, like that was a great example, giving us what somebody else is doing that is working, that we're not in that area yet, but we want to be able to provide to our community, because we know that they're a big staple in and moving our coverage forward. So what are some of the things or ideas that you have, like, oh, I wish Kaiser did this, you know, or I wish VHP did this. Like, what are some of those things that might help bridge that communication, or you know, build those different models A, B, and C? What does that look like? Please tell us who you are and where you're from.
Thanks so much. My name is Eroxai Cisneros. I'm the outreach specialist at the Gender Health Center of Santa Clara County. So I think my perspective perhaps might be a little bit different than many of the folks sitting here. However, the question was, what are some of the things that we would want to see different and changed in order to help our community be able to more accessibly connect with their healthcare? From what I see on a day-to-day, oftentimes some of our patients don't even know what type of insurance they have. I think that if Valley Health Plan can establish like some sort of patient navigators who are Spanish speakers, who can very basically break down to the patients, like, this is the name of your insurance, this is what a deductible is, this is what a copay is. Something that like unfortunately happens more often than not, even not in the Gender Health Center, but in the clinic that we're housed in, is people are not aware that they have a right to translation, and so they are not provided translators, and often when they are, the translators are on iPads or on the phone and speak very professional Spanish and still can't understand. And so, you know, there's a language barrier there, right? Like either you're denied or you're not told that you have a right to that, or you're given something that you still can't work with. So it's just kind of ridiculous. But I think that patient navigators would be really great, especially folks who can just break down like how do you make an appointment? Because folks will still walk into the clinic and try to make appointments on the spot, and we're told that we're not allowed to do that, but we'll do it anyways. But you know, what about every other clinic, right? Who's not having the people who are going to do it anyways? So yeah, those are just some of my observations, and yeah, thank you for having us today.
Thank you. I think one of the things that I can share that we do is we do have brokers that we work with in terms of the public getting insurance. It's a zero cost. We can find you matched up by language, location. There's a couple of things that we can get you matched up with, and then they can help facilitate the further step. So that's one of the things we do at VHP. If any of you ever have, like, I don't know what this means, I don't know what this is, you can go ahead and you can contact us, and we can help find you someone who's nearby that can. I do it all the time because I'm new in this insurance world, so I don't know a lot. So I'm like, I can give you an awesome broker that speaks Spanish that can answer all of your questions, walk you through line by line, explain anything you don't understand, because this is what they live and breathe. And so I think that is a way that we can definitely start helping now. Just phoning Alexis, myself, our broker number, emailing us like, hey, I need a broker in East San Jose that is by this neighborhood. We can totally help you navigate that process, and we'd be more than happy, and they will be too. So raise their books a little bit, and then it helps the community. So I'm always telling you, it's free, zero cost, we can help you. So that's something we can start doing right now. We can't hear you now. I know you're loud.
Not loud, not today.
What I'm getting from this is that we need to advertise that we have brokers more heavily in the Latino community that speak your language and that know every detail of your plan and how to navigate the system. Does that sound like a solution to this problem?
Because I didn't know we had that option, so I mean in general. So I think when I was like, oh, there's people that know all of this. So I think that is a great asset. I think we had a question.
Hi,
Hello everyone, my name is Veronica Miramontes. I'm the first. Can you guys hear me now? Veronica Miramontes. I'm the first elected Chicana Indigenous Latino for the Monterey Peninsula Unified School District. I'm just really excited to be here in campus and just everybody to network as well. But one thing I want to say in regards to how Valley Health Plan can help the community, I think definitely connecting with your local public schools and having town halls. So a lot of families are really invested into their children. Having that opportunity to have your brokers come to the schools and talk to them and have town halls to talk about what you guys offer could be a really great opportunity to also just network with our districts and have a way to provide support as well. My other title that I wrote besides being a mother is I'm the Finance and Operations Manager at MILPA. We're a nonprofit organization. Do a lot of local and national work. So that was the other thing I was going to say is besides just connecting with your public schools and sharing information, also connect with the local communities and nonprofits because a lot of the communities trust nonprofits and they have a connection there, whether it's churches, exactly. And having them that network to connect with you guys should be really good. Thank you, Pat.
Thank you.
Your San Jose Earthquakes, presented by Valley Health Plan.
Thanks, Chris.
I think also is educating our Valley Health Clinic, educating our staff. Where are their resources as well? Because remember, as soon as the provider leaves the room and the MA or the nurse is there, they feel the client feels more comfortable and safe. You know, our children did, the teacher told me that need some counseling or need schedule work or anything. If we don't give them the resources, they're just saying, well, the next time when you call, make the appointment. Don't cut it off like that. We need to educate our staff, and that's something that we have lacked for many years. And when we had the immunization clinic, and when they got, due to budget and everything in 2007, it was sent to all our Valley Health clinics. And it was a big shock for the community. They were, I can't get an appointment. I can't do this. I can't do that. Educating where you can have resources. Make a flyer, do something. But we want to be the hub to send them where they can go if they can't.
You mentioned, I think is it Valley Medical Center? Yeah? Yeah, okay.
It has been, but I think that we sometimes feel that, oh, we know it all. No. Yeah. Because things change. Especially during the pandemic, a lot of places closed. You can't send them here. You can't. Where can I go? What can I do?
What are you gonna? I think all of this is amazing information. This is all I know this is very useful to all of us. I think our wheels are already turning on what we can do, coming into the office or logging into our computers on Monday. And I think this is amazing. I know the music is about to get louder because people are gonna start coming in and their food is gonna be ready to be served. I will mention that, I know it was briefly mentioned, we do have a 24/7 service called MD Live, and you can do so many things there, from behavioral health to, there's just a plethora, the list goes on. You can schedule if you feel like you need to talk to somebody, you can find someone, match someone there, and it's just your regular copay, nothing additional. It's all within what your plan includes. So I think that is a great service that is also underrated or that we don't promote it as much, but we do have that amazing service, telehealth. That's the word I was looking for. See, that's why he's here. And I think
Even then, you have to define what is telehealth.
Yeah, define it to the community.
Define it, because telehealth something means something completely different. But if you say telehealth, like what is that?
No, that's explaining what it is that we're doing.
Telehealth is?
Like, health and tele?
Everything is a show. Oh, it's telehealth?
Sorry, that was wrong.
No, that's awesome. And so with that,
the price.